the results of the secret ballot, the floor is given to the chair of the Accounting Commission, Денис Владимирович Винников.
Esteemed Chairperson of the Dissertation Council, esteemed members of the Council. The Accounting Commission, consisting of the Chair Denis Vladimirovich Vinnikov and members Professor Jasur Alimjanovich Rizaev and Professor Amangulko Andikavna, reports the results of the secret ballot of the approval of the minutes of the Accounting Commission. 7 members participated in the secret ballot, including 3 members online and 4 in person. According to the results of the vote count, no corrections, erasures, or spoiled ballots were found. The results: voted in favor of recommending to the committee to award of the degree of Doctor of Philosophy or Doctor in the profile field, 7 votes.
We have heard the report of the Accounting Commission. There is a proposal that approves the report of the Accounting Commission by open vote. Who is in favor of this proposal? Please vote. Against, none. Abstained, none. The minutes of the Accounting Commission are approved unanimously. Thus, the Dissertation Council has voted unanimously and will recommend it to the Committee for Quality Assurance in the Speed of Science and Higher Education of the Ministry of Science and Higher Education of the Republic of Kazakhstan to award Nұргүл Еркінқызы Аблакимова the degree of Doctor of Philosophy, PhD, on the topic Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and evaluation of the effectiveness of measures to contain antibiotic resistance under the educational program AT-101-02 Medicine. To vote is unanimous. The conclusion of the Dissertation Council is depicted in the following wording. The Dissertation Council for the Educational Program 60-110-100, 80-101-02 Medicine at West Kazakhstan Marata Оспанов Medical University, based on the public defense on the dissertation work in the form of a series of articles by Nұргүл Еркінқызы Аблакимова entitled Features on the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and the evaluation of the effectiveness of measures to contain antibiotic resistance under the educational program AT-101-02 Medicine, and according to the results of the secret ballot, recommendation to the Committee for Quality Assurance in the sphere of Science and Higher Education of Ministry of Science and Higher Education of the Republic of Kazakhstan, the award of the Doctor of Philosophy PhD degree to Nұргүл Еркінқызы Аблакимова. Congratulations, Nұргүл Еркінқызы. Dear members of the Dissertation Council, are there any comments regarding the conduct of the public defense? Нет комментариев. Thank you. I thank all members of the Dissertation Council, our guests, and all attendees for their participation in today's session. This meeting of the Council is hereby declared closed. Thank you. Кирилл Алексеевич, Мажена Дворацкая, Расур Алимжанович, нас слышно? Через минуту мы начинаем заседание Диссертационного Совета.
Да, все нормально.
Видеотрансляция обязательно. Расур Алимжанович.
Добрый день всем, уважаемые коллеги.
Здравствуйте.
Здравствуйте, я здесь. Добрый день всем тоже.
Расур Алимжанович.
Здравствуйте, я здесь.
Хорошо.
Recording in progress.
Видео подключаем для записи. Начинаем. Good afternoon, esteemed members of the Dissertation Council. Allow me to extend my greetings to all of you. In accordance with Order number 126 of the Ministry of Education and Science of the Republic of Kazakhstan, dated August 2025, clause 32, a meeting of the Dissertation Council shall be deemed valid if at least 2/3 of its members are present, including official, reviewers, and temporary members of the Council, in accordance with Chapter 2, Subclause 5, Clauses 20 and 23, Subclauses 1, 2, 3, and 17, and Order number 305 of the Ministry of Science and Higher Education of the Republic of Kazakhstan, dated March 4, 2025. Concerning the formation of the Dissertation Council under the Education Program 60, 110, 100, 80, 101, 02 Medicine, a new composition of the Dissertation Council at West Kazakhstan Marata Оспанов Medical University was approved on March 13, 2025. Order number 13/2/16/193 and amended on October 9, 2025. Order number 13/2/16/542 for the defense of the dissertation by doctoral candidate Nұргүл Еркінқызы Аблакимова, titled Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and evaluation of the effectiveness on measures to contain antibiotic resistance, submitted under the education program 80-101-02 Medicine. I hereby declare this session of the Dissertation Council open. Allow me to introduce the permanent members of the Dissertation Council as a specialty 60, 110, 100, 80, 101, 02 Medicine at West Kazakhstan Marata Оспанов Medical University. Chairperson Svetlana Kalulana Sakhanova, Doctor of Medical Science, Professor, Head of the Scientific and Practical Center of West Kazakhstan Marata Оспанов Medical University. Deputy Chairperson Aynur Amanjolqızı, PhD, Associate Professor, Professor of the Department of Normal Physiology, West Kazakhstan Marata Оспанов Medical University. Academic Secretary Aygul Zakarievna Musina, PhD, Associate Professor of the Department of Pharmacology and Clinical Pharmacology, West Kazakhstan Marata Оспанов Medical University. Jasur Alimjanovich Rizayev, Doctor of Medical Science, Professor, Rector of Samarkand State Medical University, Samarkand, Republic of Uzbekistan, online participation. By order of the acting chair of the board, Rector Talas Atabayev Jabilov, dated October 9, number 13/2/16/542, for the defense of the dissertation work based on a series of articles by doctoral student Nұргүл Еркінқызы Аблакимова, entitled Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and the evaluation of the effectiveness of measures to contain antibiotic resistance to following temporary members have been included in the composition of the Dissertation Council. Allow me to introduce them. Marzena Dvoratska, PhD, habilitated Doctor of Medical Science, Associate Professor of the Department of Pharmacology, Poznan University of Medical Science, named after Karol Marcinkovsky, Poznan, Poland, online participation. Amangul Kondikovna Dusenova, Doctor of Medical Science, Professor, Head of the Department of Infectious and Tropical Diseases, Asfindyarov Kazakh National Medical University, Almaty, Republic of Kazakhstan, offline participation. Denis Vladimirovich Vinnikov, Doctor of Medical Science, Professor, Head of the Research Laboratory of Health and Environment Al-Farabi Kazakh National University, Almaty, Republic of Kazakhstan, offline participation. It should be noted that Aygul Zakarievna Musina in the scientific consultant and Svetlana Kalyulayevna Sakhanova is the co-author of one of the publication of the doctoral students. In accordance with Clause 31, Chapter 3 of the Order of the Ministry of Education and the Science of the Republic of Kazakhstan, number 126, dated March 31, 2011, on the approval of the model regulation of the Dissertation Council as amended on August 20, 2025. The chairperson, deputy chairperson, and the academic secretary of the Dissertation Council may not perform their duties at the meeting of the Council when considering the dissertation of a doctoral candidate, for whom they serve as a scientific consultant, or when there is conflict of interest. In such cases, their duties are assigned to other members by decision of the Dissertation Council. In this regard, for the session of the Dissertation Council convened to defend the dissertation based on series of articles by Nұргүл Еркінқызы, Аблакимова for the degree of Doctor of Philosophy PhD, amendments were made to the composition of the Council by other of the acting chair of the Board Director Abilov, dated October 10, 2025, number 13/2, 16, 546, the following appointment were made. Chairperson Айнура Манжолқызы, Deputy Chairperson Денис Владимирович Винников, Academic Secretary Амангуль Қуандыковна Дүйсенова. Thus, according to the attendance sheet, 5 out of 7 members of the Dissertation Council are present today. A quorum is established. Allow me to declare the meeting of the Dissertation Council Protocol number 5 at the non-profit joint stock company with Kazakhstan Marata Оспанов Medical University for the educational program 60-110-100, 80-101-02 medicine open and ready to commence its work. Agenda. The defense of the dissertation based on a series of articles submitted for the degree of Doctor of Philosophy PhD by Nұргүл Еркінқызы Аблакимова, entitled Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and the evaluation of the effectiveness of measures to contain antibiotic resistance under the education program 80-101-02 medicine. The dissertation was carried out at the Department of Pharmacology and the Clinical Pharmacology of West Kazakhstan, Marata Оспанов Medical University. The dissertation is presented in the form of a series of published articles. Languages of the defense: English. Scientific supervisors: Kazida Zhmakina Smagulova, candidate of medical science, professor, head of the Department of Pharmacology and Clinical Pharmacology with Kazakhstan Marata Оспанов Medical University, Ақтөбе, Republic of Kazakhstan. Aygul Zakarievna Musina, PhD, Associate Professor, Department of Pharmacology and Clinical Pharmacology with Kazakhstan Marata Оспанов Medical University, Ақтөбе, Republic of Kazakhstan. International Scientific Consultant, Svetlana Alexandrovna Rachina, Doctor of Medical Science, Professor of the Russian Academy of Science, National Coordinator of Collaboration between Russia and the World Health Organization Regional Office for Europe on antimicrobial consumption and resistance surveillance, head of the Department of Hospital Therapy number 2, Sechenov First Moscow State Medical University, Moscow, Russian Federation, offline participation. Official reviews. Kirill Alexeyevich Zykov, Doctor of Medical Science, Professor, corresponding member of the Russian Academy of Science, Deputy Director for Scientific and Innovative Work of the Federal State Budgetary Institution, Research Institute of Pulmonology of the Federal Medical Biological Agency of Russia, Moscow Russian Federation online participation. Alena Vladimirovna Lavrinenko, PhD, Head of the Research Laboratory of the non-profit joint stock company Karaganda Medical University, Karaganda, Republic of Kazakhstan, offline participation. To announce the list of documents submitted by the doctoral candidate, the floor is given to the Academic Secretary of the Dissertation Council, Amangul Kwandikovna Dushenova.
Good afternoon, esteemed Chairperson and distinguished members of the Dissertation Council. The personal file of doctoral candidate Nұргүл Еркінқызы Аблакимова contains all documents required by the Committee for Quality Assurance in the Sphere of Science and Higher Education of the Ministry of Science and Higher Education of the Republic of Kazakhstan. All documents were submitted on time. Allow me to present the candidate academic and professional profile. Nұргүл Еркінқызы Аблакимова is a doctoral student of the Department of Pharmacology and Clinical Pharmacology at West Kazakhstan Marata Оспанов Medical University. She completed her PhD studies under the education program AD10102 Medicine from 2021 to 2024. In 2017, Nұргүл Еркінқызы received her bachelor degree in the general medicine from West Kazakhstan Marata Оспанов Medical University. From 2017 to 2019, she completed her internship in obstetrics and gynecology, and from 2019 to 2021, her residence in clinical pharmacology. Since 2021, she has been working as the assistant at the Department of Pharmacology and Clinical Pharmacology. As part of her dissertation research, she has published 8 scientific papers, including 6 articles in international peer-reviewed journals and 2 publications in journal recommended by the Committee for Quality Assurance in the Sphere of Science and Higher Education of the Republic of Kazakhstan. She has also presented 3 conference abstracts and international scientific meetings, one of which is indexed to the Web of Science database, and holds 2 implementation acts confirming the introduction of her research results into clinical practice. She is proficient in English and holds an IELTS certificate with an overall score of 7. Thank you very much for your attention.
Are there any questions regarding the personal file of the applicant? No questions. The floor is now given to doctoral candidate to present the main points of the dissertation based on the series of published articles. You have 15 minutes to present the key findings and the conclusions of your dissertation.
Good day. Good day.
Good day, dear Chairperson, esteemed members of the Dissertation Council, and colleagues. It's my honor to present to your attention the results of dissertation work on the title, Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and evaluation of the effectiveness of measures to contain antibiotic resistance. According to analytical reports and assessment of World Health Organization, more than 1.2 million deaths are annually directly associated with infections caused by bacteria resistant to antibacterial drugs. It's projected that in the absence of effective control measures by 2050, the number of deaths attributable to antimicrobial resistance may reach 10 million per year, exceeding mortality from cardiovascular and oncological disease. Community-acquired pneumonia is one of the most common infections in adults, requiring systemic antimicrobial therapy. And it's a leading cause of antibiotic prescriptions in both hospital and outpatient settings. The COVID-19 pandemic has significantly altered antibiotic prescribing patterns. the widespread use of antibiotics for prophylaxis and empirical treatment of viral pneumonias contributed to increased resistance in a number of bacterial pathogens. Currently, Kazakhstan faces a shortage of comprehensive studies aimed at investigating the etiology of community-acquired pneumonia and key patterns of resistance, as well as evaluating the effectiveness of practical interventions to optimize antimicrobial therapy. In this regard, the aim of our study was formulated as follows: to study the characteristics of the microbial flora and its susceptibility to antimicrobial agents in patients with bacterial pneumonia in Ақтөбе, as well as to implement and evaluate the effectiveness of comprehensive measures to contain antimicrobial resistance, including antimicrobial stewardship programs and modern diagnostic methods. The achievement of this aim required addressing the following objectives. First, to conduct a systematic review and meta-analysis evaluating the effectiveness of interventions aimed at improving hospital management of community-acquired pneumonia, particular antimicrobial stewardship programs. The second, to perform a retrospective analysis of the spectrum of community-acquired pneumonia pathogens and their antimicrobial susceptibility profiles for the year 2021-2022. The third, to prospectively study the etiology of community-acquired pneumonia in the post-COVID period using culture-based methods, rapid antigen test, and polymerase chain reaction. And the fourth, to implement and assess the effectiveness of developed interventions designed to improve the quality of diagnostics and antibacterial therapy in hospitalized patients with community-acquired pneumonia. The accomplishment of these objectives made it possible to substantiate the following key propositions submitted for defense. According to the results of the systematic review and meta-analysis, antimicrobial stewardship programs in the treatment of community-acquired pneumonia significantly improve clinical outcomes, including reduction in time to clinical stability and decrease in 30-day mortality. Antimicrobial stewardship programs enhance the quality of diagnostics and contribute to the timely initiation of antibacterial therapy. Implementation of these programs increases physician adherence to treatment protocols and shorten the duration of antibacterial treatment. In the hospitals of Ақтөбе, bacterial pneumonia during the COVID-19 pandemic was characterized by the predominance of Klebsiella pneumonia and Staphylococcus aureus with a low isolation rate of Streptococcus pneumonia. High levels of resistance of gram-negative pathogens to fluoroquinolones and cephalosporins were identified, limiting the effectiveness of standard empirical therapy. In the post-COVID period, in the hospitals of Ақтөбе, among the etiological agents of community-acquired pneumonia in adults, Mycoplasmodius pneumonia and other hard-to-culture atypical pathogens predominated. The widespread use of PCR and rapid test increased the probability of identifying the etiological factor of community-acquired pneumonia. The implementation of the developed interventions in the hospitals of Ақтөбе improved the quality of patient management for community-acquired pneumonia. Physicians' adherence to national clinical protocols increased significantly. The intervention promoted the introduction of step-down therapy and systematic documented evaluation of antibacterial therapy effectiveness after 48-72 hours. The interventions also facilitated the use of severity assessment scales and rapid antigen tests in clinical practice. In order to achieve the stated objectives and substantiate the propositions submitted for defense, the following methods were employed. As a starting point, a bibliometric analysis of publication activity was conducted, serving as an overview of the research domain. For Objective 1, a systematic review and meta-analysis were carried out in accordance with PRISMA guidelines. Literature searches were performed in PubMed, Scopus, and Web of Science databases using the PICAS criteria. For Objective 2, a retrospective analysis was conducted onto medical records of 340 patients diagnosed with community-acquired pneumonia who had been hospitalized in medical institutions in Ақтөбе. Laboratory protocols, including the results of sputum culture diagnostics, were examined. For Objective 3, within the framework of cross-sectional study conducted in 2024 in 2 multidisciplinary hospitals in Ақтөбе, the etiology of community-acquired pneumonia was investigated in 184 adult patients. The diagnostic method included sputum culture, rapid urinary antigen test for Legionella pneumophila and Streptococcus pneumonia, PCR for Mycoplasmodius and Chlamydia pneumonia, as well as rapid tests for influenza and SARS-CoV-2. For Objective 4, in 2 multidisciplinary hospitals in Ақтөбе, a complex multi-level intervention was implemented with the aim of systematically improving the diagnosis and treatment of community-acquired pneumonia. The structure of this intervention was developed based on the findings of systematic review and meta-analysis, as well as the retrospective analysis of microbial spectrum and resistant patterns. Thus, each component of the intervention was grounded in prior evidence. I will start by summarizing the main results related to Objective 1. A total of 1,002 studies for systematic review and meta-analysis were identified in international databases, of which 25 were included in the qualitative synthesis and 22 in meta-analysis. The studies covered hospitalized adult patients with community-acquired pneumonia. Interventions included educational sessions, implementation of guidelines and protocols, involvement of clinical pharmacists, decision support system, and mobile application. Antimicrobial stewardship significantly improved, reduced time to clinical stability, and decreased 30-day mortality by 31%. Yes, by 31%. If to focus on diagnostics outcome, the frequency of legionella antigen testing increased almost threefold. Here. Almost threefold, but the frequency of blood and low respiratory tract sample collection did not affect significantly. Antimicrobial stewardship significantly improved timely initiation of antibiotic therapy within 8 hours of admission. However, the trend toward early initiation within 4 hours did not reach statistical significance. Time to first antibiotic administration decreased after intervention. Duration of intravenous therapy was not significantly impacted. Antimicrobial stewardship interventions reduced the duration of antibiotic therapy, and adherence to recommended regimes increased more than threefold. The results of this objective were published in the European Journal of Clinical Microbiology and Infectious Disease. In accordance with the second objective, the study included 340 patients with bacterial pneumonia hospitalized in Ақтөбе in 2021-2022, were analyzed including COVID-19 PCR positive, negative, and non-COVID cases. A total of 35 microorganisms were identified. From them, gram-negative were 46.8%, gram-positive 37.6%, and fungi in 15.6%. Mixed cultures were found in 6.18% of cases. Klebsiella pneumonia, the predominant microorganism, was isolated in 17.65% of all cases. There was no significant difference in the frequency of this pathogen among the three groups. And among the COVID-19 PCR negative patients, the most commonly isolated microorganism was Staphylococcus aureus. Considering the COVID-19 period, viral etiology was likely predominant, while the detection of bacterial flora indicated superinfection, most probably nosocomial, which explained the spectrum of isolated pathogens. This slide presents the susceptibility profiles of gram-negative bacteria isolated from patients with bacterial pneumonia. It's clearly visible that high levels of antimicrobial resistance are widespread across the escape groups with Klebsiella pneumonia, Enterobacter, and Pseudomonas aeruginosa, showing particularly low susceptibility to cephalosporins and fluoroquinolones, while maintaining comparably better responses to carbapenems. Multi-drug resistant organisms were more frequent in non-COVID patients, most likely because the majority of them were admitted after the first waves of the pandemic, when antibiotic overuse had already contributed to the spread of resistant strain. The results of this objective were published in Antibiotics. According to the third objective, a cross-sectional study was carried out in 2 multidisciplinary hospitals in Ақтөбе, enrolling 184 adult patients diagnosed with community-acquired pneumonia. Diagnostics included rapid tests for viral antigens, SARS-CoV-2 and influenza, urinary antigen test for Streptococcus pneumonia and Legionella, PCR for Mycoplasmodius pneumonia and Chlamydia pneumonia, and sputum cultures. Etiology was established in 28.8% of cases, with 61 pathogens identified. Predominant pathogen were Mycoplasmodius pneumoniae in 34.4%, Streptococcus pneumoniae in 19.7%, Klebsiella pneumonia in 11.5%, Chlamydia pneumonia and Marxella catarrhalis 9.8% each. And viral pathogens were rare, only one case of SARS-CoV-2 detection. Co-infections were detected in 18.9% of cases, often involving Mycoplasmodius pneumonia. The results of this objective were published in Iranian Journal of Medical Sciences. Moving on to the results of the fourth objective, a total of 368 patients with community-acquired pneumonia were included in the study. The implemented set of measures consisted of the following components: a single training session for nursing staff on correct techniques for collecting respiratory and blood samples, followed by integration of standard operation procedures for specimen collection. 2 targeted seminars for physicians, including internists, pulmonologists, clinical pharmacologists, and anesthesiologists, dedicated to the etiology, diagnostics, and treatment of community-acquired pneumonia. Introduction of rapid urinary antigen tests for Legionella pneumophila and Streptococcus pneumonia, as well as rapid tests for SARS-CoV-2 and influenza. Provision of clinical severity scores accessible via QR code to facilitate routine use. And establishment of an online group for real-time consultations and support in antibiotic therapy, selection and treatment monitoring. The pre- and post-intervention patients group were comparable in terms of demographic and clinical characteristics. Evaluation was conducted across 15 quality indicators of community-acquired pneumonia care. The set of these indicators was derived from internationally recognized standards of community-acquired pneumonia management and refined through our systematic review. We adopted and contextualized the most applicable indicators to ensure their relevance and feasibility within our healthcare system. Statistically significant improvements were observed in 7 indicators. Adherence to national guidelines for initial antibiotic therapy increased from 75 to 93.5%. Use of step-down therapy rose from 2.7 to 8.2%. Assessment of antibiotic therapy effectiveness at 48-72 hours increased from 40.2 to 70.1%. Documentation of criteria for discontinuation of antibiotic therapy increased from 28.3% to 52.2%. Overall severity assessment increased from 29.9% to 55.4%. CURB 65, CRB 65 scores began to be applied, reaching 8.7% of cases. Use of rapid urinary antigen tests for Streptococcus pneumonia and Legionella increased to 12. They were previously not applied. For the 7 indicators with statistically significant improvement, multivariable analysis was performed, adjusting for potential confounders such as admission during on-call shifts and baseline pneumonia severity. The results confirmed that improvements in key indicators remain statistically significant after adjustment, supporting the robustness of the intervention's effect. The results of this objective were published in Frontiers in Pharmacology. And conclusions of the study, with your permission, I will not read them aloud.
Thank you, Nұргүл Еркінқызы. What questions do the members of the Dissertation Council have for the applicant regarding the presented dissertation based on the series of articles? You may ask your questions to the doctoral candidate.
I have a couple of questions. First of all, I would like to thank you for your nice presentation, and I'm really impressed with the publications that I really had a chance to dive into a little deeper. And I do have a couple of questions related to the outcomes of your study associated with resistance and the prevalence of different pathogens in the Kazakhstan population. First of all, Nұргүл Еркінқызы, I would like to wonder, what do you think, I mean your personal opinion based on the studies that you've conducted, what do you think is important to do, or do you have any proposals or ideas to edit the clinical protocol of COPD patients in whom the risk of pneumonia is quite high, and based on the findings of your study where Streptococcus pneumonia is not a prevalent agent, but vaccination against Streptococcus pneumonia with pneumonia vaccine is highly recommended. What do you think is then needed to do? Do you propose to amend or change this clinical protocol to COPD patients given that the prevalence of this agent is quite low, or nothing has to be done in this regard?
Thank you very much, Denis Vladimirovich, for your question. Allow me to answer. Firstly, I will tell that our results may not show the true results. Why? Because Streptococcus pneumonia is one of the hard to culture pathogens. So maybe the number of isolates of Streptococcus pneumonia should be higher. And according to the objective 3, we try to improve this diagnostic methods by including two culture method, antigen test for Streptococcus pneumonia, which can be which is unaffected to previous antibacterial therapy, and I think the patients with the risk factors, like the patients with chronic obstructive pulmonary disease, should be vaccinated against Streptococcus pneumonia.
Okay, excellent. My next question is, since your findings were predominantly for Ақтөбе region, what do you expect to see all over the country? I'm talking about the rest of the country. Do you expect the difference in the antibiotic and antimicrobial resistance spectrum in the rest of the country?
Thank you very much for your question, Denis Vladimirovich. Let me answer. I think the microbial landscape of the patients with community-acquired pneumonia should be close, same in different parts of the country. But to prove this information, we should make more large and prospective studies to understand if it's true or not, to understand the resistant patterns of pathogens of community-acquired pneumonia. And I think mostly they should be the same, and Streptococcus pneumonia, Haemophilus influenza should be one of the predominated pathogens.
And I have one more final question, all right? Do I have time? Given that science is not done for science only, but science is done for action, then your intriguing and sometimes anecdotal findings on the antimicrobial resistance of the most prevalent antibiotic agents are quite calling for action. What do you, as a medical advocate, as a scientist, what are you going to do to promote or to foster the ban of over-the-counter sale of antibiotics with no prescription? Would you go to the ministry to urge them to stop selling antibiotics with no prescription? What is your plan to call for more action?
Thank you very much for your valuable question. I think so. Allow me to answer. Like a clinical pharmacologist, I can tell that I will try to do my best in this way, but not like going to the minister, but trying to educate our colleagues, clinicians, and the people also, because they are also responsible for their health. And I'm for 100% sure that all antibiotics should be sold in the pharmacies only with prescriptions and to contain antimicrobial resistance.
Are you pleased with the answer, Denis Vladimirovich?
I am completely satisfied. Thank you.
Thank you. Next.
Thank you, Dr. Erkінқызы. Thank you very much for your presentation. May I ask in Russian question? In Russian language. Нұргүл Еркінқызы, у вас были пациенты в анамнезе, у которых был SARS-CoV-2+. Это была вирусно-бактериальная пневмония или чисто вторичная бактериальная пневмония? Каков вклад SARS-CoV-2 в диагнозе? Если это была вирусно-бактериальная пневмония, перенесли ли они COVID-19 в анамнезе, клинически выраженную COVID-19 в анамнезе? Если да, то проводилось ли МКТ, какой процент поражения легких был, и были ли дифференциально-диагностические критерии именно по компьютерной томографии между вирусной и бактериальной пневмонией. То есть COVID-19 нас пандемия научила дифференцировать вирусную и бактериальную пневмонию по методам визуализации. Понятие, да, мой вопрос?
Да, вопрос, единственное уточнение. Я хотела бы спросить касательно результатов ретроспективного анализа или проспективного анализа?
Которого анализировали, да.
Амагуль Куандыкна, большое спасибо за... На русском? Нет, на русском. Амагуль Куандыкна, большое спасибо за вопрос и за высокую оценку работы. Я бы ответила так, что по данным мировых авторов, того же Лэнгфорта, на самом деле во время коронавирусной инфекции основным возбудителем пневмонии, внебольничной пневмонии, был вирус SARS-CoV-2. Но, к сожалению, большинство пациентов получали антибактериальную терапию, нерациональную антибактериальную терапию. И спектр возбудителей, который мы получили в наших результатах, тоже показывает, что данные возбудители, они вторичные, то есть это вирусно-бактериальная инфекция, и они больше показывают спектр нозокомиальной пневмонии, нежели внебольничной пневмонии. То есть это суперинфекция, а пациенты госпитализировались по поводу вирусной пневмонии.
Спасибо. Второй вопрос, связанный с этим. В каких отделениях лечились ваши пациенты, которых вы анализировали? В соматическом отделении или в отделении интенсивной терапии и реанимации? И были ли случаи летальности и каков показатель летальности среди анализированных в вашем ретроспективном анализе ваших пациентов? Но это в вашу работу не входило, но изучая, проводя исследования, вы, наверное, видели, да, такие результаты?
Да, видела, но спасибо большое за вопрос, Амагуль Куандыкна, разрешите на него ответить. В цели нашего данного исследования, правда, не входило анализирование этих характеристик пациентов. Мы работали над анализом результатов бактериологического посева, но данные пациенты получали лечение в провизорных на то время стационарах города Ақтөбе. То есть в том числе в реанимациях внутри этих провизорных стационаров, но это не общепрофильные и не терапевтические отделения, это именно провизорные, которые открывались во время коронавирусной инфекции стационара.
Спасибо большое. Вот вы сказали, что это была нозокомиальная инфекция. У вас в спектре патогенов не прозвучал возбудитель ацинетобактер баумани. Или я не увидела? Не было, по-моему, да?
Ацинетобактер баумани, такого возбудителя, да, в спектре по ретроспективному анализу не было.
Не было. Спасибо большое. И заключительный вопрос. Вот в Ланцете опубликована статья доктора Сауранбаева Таланта из Киргизстана, где они проводили сопоставление или дифференциальную диагностику вирусной бактериальной пневмонии на основе показателей ЦРБ. Не проводили ли вы такое исследование и в то же время назначение таргетной эффективной антибиотикотерапии позволяло, сразу способствовало снижению этого показателя? Не обратили ли внимание на данный аспект? Спасибо большое.
Спасибо большое за вопрос. Могу разрешить на него ответить. Хочу сказать, что данные собирались совместно с данными демографическими и клиническими характеристиками пациентов, но корреляцию уровня СРБ у пациентов с исходами у пациентов мы не проводили.
Спасибо большое, я удовлетворена.
Профессор Дворацкая, вы можете задать свои вопросы докторанту.
Thank you very much. So I'd like to first of all congratulate you. You're very well based and very logically conducted study. So I've read it with great pleasure. And my question will concern also like like all other members of Dissertaционный Council, will concern some issues, diagnostic issues. First of all, I'd like to know if you realize what kind of limitations are related to the use in diagnostics of sputum culture instead of bronchial lavage. Of course, I realize that bronchial lavage is not used for all of patients with community-acquired pneumonia. Nevertheless, I suppose you considered any type of limitations resulting from this type of diagnostics. And the second question concerns also the urine test for Legionella. What is your opinion concerning its usefulness, especially at early phases of infection? I think about its sensitivity or affinity. So, two first questions.
Professor Dvoratsky, thank you very much for your kind words and insightful observations. Let me answer your questions. First question about the sputum culture and the bronchial lavage. We fully agree that bronchial lavage has a higher diagnostic accuracy comparing with sputum culture, but it's an invasive method and cannot be applied routinely, so that in our healthcare settings in the hospitals, sputum remains the main diagnostic material for the patients with community-acquired pneumonia. To apply quality control, there should be a strict control indicators about the inflammatory cells, epithelial cells in the sample. So, and furthermore, we, according to our objective 4, try to improve sputum culture collecting in our hospital settings by providing for nursing staff training sessions on correct specimen collection. And about urinary antigen test, the urinary Legionella antigen test has some benefits. We can do them in the bedside. It's not affected with the previous antibacterial therapy, and the results can be obtained in 15 minutes after the implementation of this method. And one more thing, some of the patients cannot produce sputum samples, and in this case, it can be a good method to start targeted therapy, and it's more sensitive because bacteremia in Legionella pneumonia is uncommon, and antigens in the blood in a very low amounts, which cannot be detected by the diagnostics method. So in urine, the amount of the antigens are higher, and it can be detected by these tests.
Okay, thank you very much. By the way, with your interventional part of your study, is the only what I'd like to know is your opinion. Do you suppose it would be useful? I know you didn't this part, what I'd like to suggest just now, but do you, in your opinion, it seems to be useful to conduct any type of retrospective documentation analysis to find the exact medical errors in terms of pharmacotherapy, of course, in terms of therapy of community-acquired pneumonia, to analyze them with the physicians or nurses who are involved just in this exact problem. What's your opinion about this idea? For future, of course, not for your work.
Thank you very much for your question, Professor Dvorotska. Allow me to answer. First, I will clarify that in our results, according to the objective 4, we didn't do such kind of things. We analyzed all medical documentation after the finishing of our whole duration, pre-intervention and post-intervention period. But I think it will be useful for the doctors if we will check their medical documentation before and maybe show real-life situations with the patients for them to improve the quality. But we tried to do it by implementing messenger group for them during the study. But this group solely were useful for consultations, and if they wanted, only according to their desire. If they want to consult, to have a consult, we give it. But we didn't routinely check their medical documentation or treatment of the patients in that time.
Thank you very much for the explanation. Thank you.
Thank you. Are there any further questions regarding the dissertation based on the series of articles? Жасур Алимжанович, вы можете задать, если вопросы есть, на русском.
Да. Thank you so much. Dear colleagues, I think today we discussed a very actual problem. It is not a problem for the Republic of Kazakhstan. It is a very big problem for Uzbekistan Republic. That's why I have one question for this presentation. Please, can you tell me about how long continue the very bad situation around antibacterial resistance? On the literature I read about this very bad situation in the world. That's why I wanted to know about this problem. How long this problem will continue in Kazakhstan, for example, in Uzbekistan, in the world. I think we together have to study this is the problem and the implementation, anything. Thank you.
Thank you very much for your questions. Allow me to answer. I really cannot answer to this question. Analytical reports said that if we will not make some good, effective measures, the number of deaths attributable to antimicrobial resistance will increase. Until 2050, the number of deaths will be more than 10 million people per year. But I hope that if such kind of studies and if the clinicians and even people will try to improve the situation with antibiotic consumption and appropriate use of antibiotics, and we can change this, how to say, yes, not so good trend.
Thank you so much. Thank you. Спасибо огромное.
Спасибо. If there are no questions, we shall proceed to the next stage of our meeting. The floor is now given to the scientific supervisors. The floor is granted to the first scientific supervisor of the doctoral candidate, Газиза Жмакиевна Смагулова, candidate of medical science professor, head of the Department of Pharmacology and Clinical Pharmacology with Kazakhstan Марат Оспанов Medical University.
Dear Chairman, dear esteemed members of the Dissertation Council, may I present my review. Nұргүл Еркінқызы Аблакимова graduated from our West Kazakhstan Medical University in 2019. Then she completed full course of residency in clinical pharmacology, and in 1925-1923 she finished and fulfilled doctoral program in medicine. And to say honestly, I'm very proud to have some unique students which that I was a teacher for these unique students. If we say about the dissertation represents a study conducted at the intersection of clinical microbiology and clinical pharmacology, focusing on the one of the most urgent problem of modern medicine, bacterial resistance to antibiotics. Antimicrobial resistance remains one of the most serious threats to global health, much of which is associated with the excessive and irrational use of antibiotics, especially in respiratory tract infections. As a part of preparation of materials and development of complex interventions, in 1993, Nұргүл Еркінқызы completed scientific internship in Afyon Karakhasir University of Health Science in Turkey, which allowed her to integrate modern international approaches in the field of antimicrobial stewardship into the concept and implementation of her research. The dissertation demonstrates a high level of scientific maturity and independence of a candidate. The research is based in a solid methodological foundation and covers the entire spectrum of stages of scientific inquiry, from identification of problem and setting objectives, obtaining and interpreting reliable results. The work addressed complex and socially significant aspects of healthcare system. The dissertation is presented in the form of a series of articles published in a peer-reviewed journals, including Web of Science and Scopus. In addition, the main provisions of work were published in journals included in the list recommended by the Science and Higher Educational Quality Assurance Committee of the Ministry of Science and Higher Education of the Republic of Kazakhstan, and were presented at the 9th International Scientific Conference, which confers their relevance and recognition both in Kazakhstan and in the international scientific society. The conducted research makes significant contribution to understand regional aspects of antimicrobial resistance and may serve as a reliable scientific basis for developing programs to rationalize antibiotic therapy in clinical practice. Considering the relevance of the topic, significant justification, practical significance, and quality of the work performed, I believe that the dissertation by the series of articles of Nұргүл Еркінқызы Аблакимова fully meets the established requirements for awarding the degree of Doctor of Philosophy in educational program AD 101-02 Medicine, and deserve a positive evaluation. So I wish Nұргүл good luck for future. Thank you.
Thank you, Gizashmagina, for your review and remarks. The floor is now given to the second scientific supervisors of the doctoral candidate Aygo Zakarevna Musina, PhD, Associate Professor of the Department of Pharmacology and Clinical Pharmacology with Kazakhstan Marata Оспанов Medical University.
Good afternoon, esteemed members of the Dissertation Council. Ablakimova Nұргүл Еркінқызы's dissertation address current healthcare challenges and aims to develop an evidence base for optimizing antimicrobial therapy and rational use of antibiotics is community-acquired pneumonia. The dissertation demonstrates a high level of scientific maturity and independence of the part of the candidate. The research was built on a sound methodological foundation and encompasses the entire spectrum of scientific inquiry, from problem definition and goal formulation to obtaining, interpreting and analyzing reliable results. The results of the dissertation research were presented at 9 international scientific conferences, demonstrating the doctoral students' high level of academic activity and the scientific community's interest of the topic. The presentations spanned both national and international scientific venues. Thus, the dissertation works of Ablakimova Nұргүл Еркінқызы in terms of the relevance of the topic, scientific and practical value of the results is a completed, independent scientific study and meets the requirements for works for the degree of Doctor of Philosophy and the educational program AD 10102 Medicine, and is absolutely worthy of being awarded the degree of Doctor of Philosophy, PhD. Thank you.
Thank you, Nұргүл Zakarievna, for your review and the comments. The floor is now given to the international scientific consultant of the doctoral candidate Svetlana Alexandrovna Raichina, Doctor of Medical Science, Professor of the Russian Academy of Science, National Coordinator of Cooperation between Russia and the World Health Organization Regional Office for Europe on Antimicrobial Consumption and Resistance Surveillance, and the head of the Department of Hospital Therapy number 2, section of 1st Moscow State Medical University, Moscow, Russian Federation.
Thank you very much for introduction. Dear Chairperson, dear colleagues, let me share with you the key points of my reference letter on the thesis of Ablakimova Nұргүл Еркінқызы entitled Features of Microbial Flora and its resistance in patients with bacterial pneumonia in October, the introduction and evaluation of the effectiveness of measures to contain antibiotic resistance applied for PGD in medicine. As other speakers have emphasized, antibiotic resistance remains one of the most serious global healthcare threats of the current century, which takes millions of human lives and imposes high economic burden. And pneumonia, due to its high incidence, makes a significant contribution to this. Therefore, the research of Nұргүл aimed to improve the quality of care and antibiotic use practice in hospitalized adults with pneumonia, and thus prevent the spread of the resistance among respiratory pathogens, is not only relevant but strategically important for both regional and national healthcare systems. The thesis, which is presented today, consists of several logical and relevant parts: a comprehensive review of international practices in studying antibiotic resistance among bacterial pneumonia pathogens, an analysis of the bacterial pathogen structure in Ақтөбе hospitals, among with their antibiotic susceptibility profiles, a systematic review and meta-analysis of current antimicrobial stewardship interventions in the diagnostics and treatment of community-acquired pneumonia, and finally, practical implementation of a comprehensive intervention to improve the quality of care for hospitalized adults with CAP in 2 hospitals in Ақтөбе region. I'd like to say that all parts of this thesis can be considered completed scientific studies of high methodological quality, distinguished with theoretical depth, analytical precision, and applicability in clinical settings. The research makes a significant contribution to the study of regional patterns in infectious diseases, etiology, treatment practices, and antibiotic resistance, and may serve actually as a perfect foundation for future antimicrobial stewardship interventions. It should be noted that the main results of the research have been published in high-ranking international journals and presented at several international conferences that promote knowledge exchange and further international collaboration. In terms of applicant herself, I'd like to say that Nurgul demonstrated a high level of knowledge in the subject around the study, has proven herself to be an independent, proactive, and highly motivated researcher that I have rarely met before. All steps of her scientific research, from literature review and research proposals to data collection, statistical analysis, discussion, and conclusions, were carried out consistently and with the required scientific rigor. During the entire period of our collaboration, Nurgul maintained high level of initiative, analytical thinking, and scientific discipline, while remaining open, adaptable, and willing to consider all suggestions and ideas. It has been a great pleasure and honor for me to be your international scientific supervisor, and I wish you all the best in your future scientific career. So, as a conclusion, I'd like to say that the thesis of Ablakimova Nұргүл Еркінқызы undoubtedly meets all the requirements for the degree of PhD in the educational program number 8D10102 in medicine and deserves a high assessment. Thank you very much.
Thank you, Svetlana Alexandrovna, for your review. The floor is now given to the first official reviewer, Kirill Alexeyevich Zykov, Doctor of Medical Science, Professor, corresponding member of the Russian Academy of Science, Deputy Director for Scientific and Innovative Work at the Federal State Budgetary Institution Research Institute of Pulmonology of the Federal Medical Biological Agency of Russia, Moscow, Russian Federation.
Thank you very much. Thank you very much. I hope that the sound is clear. And first of all, dear chairperson, dear colleagues, I'd like to thank for inviting me as the official opponent or reviewer for this dissertation. And frankly speaking, it's my first experience of participating in a dissertation defense which is based on a compilation of the publications. But it is really nice and of my conclusion. And first of all, I'd like to tell you that the topic of the dissertation is crucially important for all of us, not only for Kazakhstan or Kyrgyzstan or Russia. It's important for every country in the world, and I'd like to stress that such prospective studies, well, frankly speaking, have to be conducted not only in every country, but in every big city or every area of the big city, because it was clearly demonstrated before that the antibiotic resistance can differentiate, can be different in different areas of, for example, one policy. And that's why this topic is very important. And dissertation corresponds to a priority scientific area which is approved by a high scientific and technical commission under the government of the Republic of Kazakhstan. And it aligns with the immense direction. Let's speak about the significance of this work. The dissertation research makes a significant contribution to the implementation of the national strategy for combating antibiotic resistance as it comprehensively addresses the issue of resistance in patients with bacterial pneumonia. Very, very important question, and it is necessary to organize such works again and again. Speaking about the principles of independence, the PhD candidate conducted a thorough review of scientific sources relevant to the dissertation topic. She independently developed a research database, performed statistical adequate, I'd like to stress, statistical analysis, interpreted the results, and formulated conclusions and practical recommendations, which are really logical and being directly involved in conducting studies. It is very, very important. Speaking about the dissertation based on the compilation of publications, it is very important to show the integrity of these publications. The inner logic of these publications, and I can tell you that the principle of internal unity here is present, and I can tell you that there is a justification of relevance. Antimicrobial resistance is recognized as one of the most serious global threats to public health and represents a priority area in both international and national healthcare programs. Against the backdrop of increasing resistance of bacterial pathogens to widely used antibiotics, particularly in respiratory infections such as community-acquired pneumonia, the risk of ineffective therapy and mortality continues to rise. Speaking about the main topic of the dissertation, content reflects this topic absolutely, and I can assure you. Speaking about the aims of objectives, they correspond to the topic absolutely, and the aim and objectives are fully consistent with the topic of the dissertation. The formulated objectives logically follow from the main goal and are directed toward the sequential study of the etiological, microbiological, and clinical pharmacological aspects of antimicrobial resistance and bacterial pneumonia. Speaking about different sections, different statements of this dissertation work, I can tell you that they are logically fully interconnected. It is very important. All articles included in the dissertation are logically interconnected and addresses the different areas of one such big problem of antimicrobial resistance. First of all, the article bibliometric analysis of global research output of antimicrobial resistance among pneumonia pathogens. Then the article antimicrobial stewardship interventions in hospitalized adults with community-acquired pneumonia, and then prospective studies. They are really, they have really good inner interconnection with each other. And speaking about critical analysis. Critical analysis is present in every article, and it's a pleasure for me to stress that in every article there is the part with the limitation of the words. So it's really important because we know that there is no any ideal work. Every work has its own inner limitations, and in these articles, the author is stressed on the limitations of the precise work. So, speaking about the novelty of this data, yes, they are new. I can't tell you that they are entirely new. They are very important, and it is necessary. I'd like to stress that it's necessary to organize such works constantly in every area our countries. So, and every such work will be the new one. The scientific results and findings presented in the dissertation demonstrate a high degree of originality and novelty. A systemic review and meta-analysis were conducted, summarizing global evidence on the effectiveness of antimicrobial stewardship programs in community-acquired pneumonia, which made it possible to identify key trends, gaps, it is very important, and directions for implementing such approaches in clinical practice. It is very, very important. The conclusions of the dissertation are novel, scientifically grounded, and consistent with the stated objectives. So it's very, very good. Well, it's have the good inner structure. Speaking about the analysis, based on the analysis of global and local clinical experience, a comprehensive set of measures was developed to optimize the diagnosis and antibacterial therapy of community pneumonia. It is very, very important. Speaking about the conclusions presented in the dissertation, well, they are based on the robust evidence obtained through comprehensive analytical methods. It is very, very good. Speaking about main provisions submitted for the patents. According to the results of the systemic review and meta-analysis, antimicrobial stewardship programs in the treatment of community-acquired pneumonia significantly improve clinical outcomes, including the reduction in time to clinical stability and decrease in 30-day mortality. I have one question towards this statement, but I will tell you at the end of my small talk. Speaking about well, those part of the dissertation that was conducted in October. In the hospitals of the city, bacterial pneumonia during the COVID-19 pandemic was characterized by the predominance of Klebsiella pneumonia and Staphylococcus aureus, with a local isolation of Streptococcus pneumonia. Yes, I absolutely agree with a colleague that asked about the prevalence, the prevalence of Acinetobacter baumannii, which was one of our main enemies during the COVID-19 pandemic. You know, and it was really hard to treat the patients with multi-drug resistant or even pan-resistant Klebsiella pneumonia and Acinetobacter baumannii. Then principles of reliability. Methodologically, these these parts of the dissertation were conducted really, really good. The choice of research methodology is well justified and consistent with the stated aims and objectives of the work, which allowed obtaining reliable and, it is very important, reproducible results. And systemic review and meta-analysis were conducted, followed by cross-sectional studies and reinforced intervention study. The methodological approach is characterized by logical structure, internal consistency, and coherence. So, really, really nice. Results obtained using modern methods and computer technologies were presented in this work, and these methods were absolutely adequate. Theoretical conclusions, models, relationships proven by experiments, were really good, and so it is absolutely logically stated in the proposal. There are important statements confirmed by relevant literature, and I'd like to stress that the analysis of the literature is really good. And there is just one thought about this point. something, because sometimes some articles, some local articles concerning the data from local databases are published in the articles in the journals which are not indexed, for example, in Web of Science and Scopus, and maybe it is wise, maybe your further work to include these data, because sometimes you're losing something very, very important. Speaking about the literature sources, they're absolutely sufficient for so it was really good. And finally, a principle of practical value. The dissertation has absolute theoretical significance, no doubt. The dissertation has practical significance, and the results are likely to be applied in everyday clinical practice, certainly. And practical recommendations are very good, and it's necessary to implement these practical recommendations. Approving these recommendations. And speaking about quality of writing and formatting, I can absolutely assure you that academic writing quality is very high. With our connection, and finally, the quality of writing is really good, and those articles are very journals of very good quality. While speaking about their questions, well, I have two questions, because one of my question was answered before during the discussion, during the previous discussion, and first of my questions will be about the effect of the implementation of antimicrobial stewardship in clinical practice, because based on the literature, because it was stated that you can reduce the 30-day mortality by 31% using this program. But I'd like to ask the dissident that the main source of data was the article published by Mikan and colleagues 25 years ago. And in this article, and the weight of this article is up to 40%. And this article was published 25 years ago, and only old persons more than 65 years old were included in this article. What do you think? Is it reliable to extrapolate the data from this article on the whole population, on all the modern population of community-acquired pneumonia patients, and is possible to use it in your analysis?
Thank you, Kirill Alexeyevich, for your review. The floor is now given to the doctoral candidate to respond to the reviewers' comments and to present conclusions based on their recommendation. Please, Nұргүл Еркінқызы.
Kirill Alexeyevich, thank you very much for overall good assessment of our work and very insightful feedback. Allow me to answer your question. According to the results of systematic review and meta-analysis, we included in our meta-analysis the study which was conducted by Mihan, and the results of this study was published in 2001. We included this study. Why? Because the study met all criteria predefined for this systematic review. This is a first, and the set of implementations which was made by these authors the same as the current evidence and the more recent studies. And furthermore, we made some statistical sensitivity analysis, and according to the results of living out analysis, this study were not the only driver of the overall results of this meta-analysis, and excluding this study and other, for example, large studies, like more recent large studies made by Ridgway, there were more than 3,000 patients. Excluding such kind of large studies did not affect on an overall final results of our meta-analysis, which showed that the results significantly were robust and were not made. The results were not made in only the data set of this study.
Thank you very much. I'm absolutely satisfied with your answer. And the second question, if I may. Well, I was just curious that in one of your articles it was clear, it was shown that comparing the groups of the patients with COVID-19 and without COVID-19 community-acquired pneumonia, more strains with multi-drug resistance were in the patients without COVID-19, and even more than in COVID-19 groups. How can you explain this phenomenon?
Thank you very much for your question, Kirill Alexeyevich. Allow me to answer it. Yes, according to the results of the Objective 2, the higher frequency of multi-drug organisms in non-COVID patients cases was unexpected finding for us, and it should be interpreted cautiously. According to our data set, the most patients without COVID were admitted to the same hospitals later than the previous groups, like patients with COVID and PCR positive and PCR negative patients. And we can think that in that time, the unnecessary exposure with exposure of antibiotic in the first waves of COVID can alter the resistant patterns. But we cannot really answer this question right now. Why? Because we cannot be sure that this post-COVID results, and more large prospective studies are necessary to truly answer what was the impact of COVID-19 pandemic on the resistance patterns in our local epidemiology.
Thank you. Thank you. I'm satisfied. And finally, I'd like to proclaim the statement that summing up the review of the dissertation by a series of articles by Nұргүл Еркінқызы Аблакимова entitled Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and evaluation of the effectiveness of measures to contain antibiotic resistance, submitted for the degree of Doctor of Philosophy in the specialty AD 1010-2 Medicine. It should be concluded that this dissertation, prepared in the format of the series of scientific articles, represents a completed scientific work, presented scientific novelty, but possessing scientific novelty, as well as theoretical and practical significance. The content and the results of the research fully correspond to the stated topic, while the structure and formatting of the work meet the established requirements for dissertations based on a series of publications. The dissertation meets all criteria and it's required for the award of the Doctor of Philosophy degree and the specialty AD 1010-2 Medicine. The candidate deserves a petition to the Committee of Quality Assurance in Science and Higher Education of the Ministry of Science and Higher Education of the Republic of Kazakhstan for the conferment of the Doctor of Philosophy degree. Thank you very much, and my congratulations to the author and for the supervisors.
Thank you, Kirill Alexeyevich. The floor is now given to the second official reviewer, Alena Vladimirovna Lobinenko, PhD, head of the research laboratory of the non-profit joint stock company, Karaganda Medical University, Karaganda Republic of Kazakhstan.
Thank you for Nұргүл. So my review. Criteria number 1, the dissertation corresponds to the priority area of scientific development approved by the Higher Scientific and Technical Commission under the government of the Republic of Kazakhstan. The research was carried out within the framework of the scientific and technical project contaminated bacterial infection and pharmacoepidemiology of antibiotic resistance in the patient COVID-19, the dissertation in the Ақтөбе region. The dissertation meets the current priorities of the national scientific policy and the practical objective of Kazakhstan healthcare system, particularly of the context of containing the global rate of antibiotic resistance and improving medical care for community-acquired pneumonia. The work makes a significant contribution to science and it's important and well articulated. The dissertation research is relevant and elegant with priority scientific dissertation addressing the critical issue of antibiotic resistance in bacterial pneumonia. The novelty of the study is supported by the extensive use of modern diagnostic and interventional methods, and the obtained result can be scaled and applied within the healthcare system of the Republic of Kazakhstan. The work is well substantiated, logically structured, and meet international standards of science and research. Principle on different of independence level high. The author independently identified relevant scientific problem, developed and implemented of comprehensive research programs. They included retrospective and prospective analysis, the introduction of modern diagnostic method, and the implementation of antibiotic-resistant control program. Principle of internal unity, justification of the relevance of the dissertation well. The relevance of the chosen topic is convincingly substantiation against the backdrop of the global trends of increasing antimicrobial resistance and the emergence of new threats of public health. The author effectively reveals the cause and effect relationship between local clinical problem and global trends, making it possible to recommend the work as an important contribution to national strategies for combating antibiotic resistance. The content of the dissertation reflects the topic of the dissertation reflects. All chapters, sections, and structural elements of the dissertation are strictly aligned with the stated topic, reflecting the definite objective and subject of the research. The aim and objectives correspond to the topic of the dissertation. The aim of the study is clearly linked to the main problem of the dissertation, the investigation of the characteristic of the microbial flora and the control of antibiotic resistance. All section and provision of the dissertation are logically fully interconnected. The dissertation is distinction might be strict logic and international consistency. Each section organically follows the previous one, successively revealing the research topic. The result of each stage are used to substantiation, conclusion, and practical recommendations. The new solutions, critical analysis is present. The dissertation provides a critical analysis comparing the developed methods with widely used international and national standards, which allowed identify their advantages and limitations. Principle of scientific novelty, partition new 75%.
The scientific results and statements are partially new, as the dissertation theoretical substantiation it empirically confers case aspect of microbial flora and antibiotic resistance in bacterial pneumonia within a specific region, contributing a value local retrospective to global scientific practice. However, some of the propositions are based on already established concept and international data. The partial new 75%, the conclusion of the dissertation are partially new, as they summarize the author's original research results in the context for existing studies, proposing new approach to antibiotic resistance control. However, not all conclusions are fundamentally groundbreaking. The technical, technological, economical, of managerial solution are new and well-founded. The technical, technological, and organizational solution developed is the dissertation and partially innovation. Their justification is provided. Validity of the main conclusions. All main conclusions are based on scientifically significant evidence or sufficiently well substantiated for quality research and field of study, the arts and humanities. The author has formulated and implemented new approach to antimicrobial stewardship and the diagnostic of bacterial pneumonia, expanding the theoretical and practical understanding of local feature of antibiotic resistance. Has this statement been proven? Is trivial? No. It is new? Yes. Level of applicability broad. Has been proven this article? Yes. A systematic reviews and meta-analysis demonstration that comprehensive antimicrobial stewardship program in the treatment of community-acquired pneumonia significantly accelerate in achievement of clinical stability. The etiological structure of bacterial pneumonia in hospitals Ақтөбе during COVID-19 pandemic was characterized by the predominance of gram-negative escape bacteria and a high level of antimicrobial resistance, which necessitates a revision of standard imperial therapy regimens. In the post-COVID period, the causative agents of community-acquired pneumonia in adult patients were predominantly mycoplasma pneumonia and other hard-to-culture atypical microorganisms. The implementation of complex intervention in healthcare institution of Ақтөбе significantly improved the quality of diagnostic and treatment of community-acquired pneumonia, increased healthcare personnel, address of national clinical protocol, introduced stepwise therapy. Criteria number 8, principle of reliability of source and provide information, choice of methodology, justified of methodologies sufficiently described, yes. The choice of methodology is justified as described in detail. The author has substantiated and selection of the applied methods and thoroughly outlined the sequence of the research procedure, ensuring the transparency and reproducibility of the study. The results of the dissertation were obtained using modern scientific research methods and techniques for data processing and interpretation with the use of computer technology, yes. The results were obtained using modern methods and data processing techniques, including computer technologies. Theoretical conclusions models, identity relationships, and pattern proven and confirmed by experimental research, yes. Theoretical conclusions model interrelation and patterns experimentally validate. The source of literature use of suffix. The study articles present and variety of relevant sources and compressing both domestic and international publication of the research topic. The demonstration, the author's awareness of the subject matter and the thoroughness for the research undertaken. The principle of practical value. The dissertation has theoretical significance, yes. dissertation has practical significance, and there is a high probability that the obtained results will be applied in practice. Yes, the practical proposal подтверждает 75%. The dissertation has particular significance with a high likelihood of implementation. Criteria number 10, quality of writing and formatting. Quality of academic writing high. The work demonstrates a high level of academic writing. Comments of the dissertation. There were no comments on the dissertation content based on the series of published articles. During the dissertation review process, the following questions were raised. Why were patient COVID-19 selected for the retrospective analysis? Why did Klebsiella pneumonia and Staphylococcus aureus predominate in bacterial pneumonia, which allow isolation rate of Streptococcus pneumonia rather than classical pathogens such as beta-hemolytic streptococci, pneumococci, and Haemophilus species? Should the screening test used is a study by introduced into routine hospital practice? What was the rationale for describing the comorbidities of the patients? Are there in regional features and the etiological structure of pathogens associated with community acquired pneumonia? Where is the laboratory diagnostic method, PCR or culture? Comprised the study. Where is any limitation in the study? During the review and our discussion, the PhD candidate provide clear and well response answer to all the questions raised. The scientific level of the doctoral candidates, articles on research topics. Article number 1. Bibliometric analysis of global research output of antimicrobial resistance among pneumonia. The article demonstrates a deep bibliometric analysis and comparison key direction and trends in global antimicrobial resistance research. Scientific level high. Article number 2. Antimicrobial stewardship and intervention in hospitalized adult with community-acquired pneumonia, a systematic review and meta-analysis. It's characterized by a high level of evidence. A systematic review and meta-analysis were conducted, including a result from more than 20 large-scale studies of antimicrobial stewardship programs. Scientific lab high. Article number 3, microbial landscape and antibiotic susceptibility, profiles of microorganisms in patients with bacterial pneumonia, comparative cross-sectional study of COVID-19. This original study with a particle orientation compass compares the etiological structure of pneumonia in patients with and without COVID-19. Scientific level high, and has research impact of complex intervention of antimicrobial therapy and etiological diagnostic of community acquired pneumonia. Frontiers coordinate the study illustrate the successful implementation of multi-level interventions, education diagnostics, and organizational aimed in improving the management quality of patients with community-acquired pneumonia. Scientific level high. Appendix A and Appendix 2. Scientific level high of the formal of a letter to the editor. Decision of the official review. Summing in the review, the dissertation by Nұргүл Еркінқызы Аблакимова, entitled Future of the Microbial Flora and its Resistance in Patient with Bacterial Pneumonia in Ақтөбе, the Introduction and Evolution, the Effectiveness of Measure to Contain Antibiotic Resistance, submit for the degree Doctor of Philosophy in the specialty AD 1010 Medicine. It should be noted that dissertation meet high standards of scientific, originally relevance and methodological rigor. The present publication comprehensive cover all key objectives. as of the dissertation, research demonstrate a high level of scientific accuracy, are published in international indexing journal, and contribute to the improvement on national and regional medicine practice. The author has shown independence, a deep command of methodology, and critical thinking. The content and the results of the study full correspond to the stated topic. The structure and design of the dissertation comply with the established requirement for works completed is a format, a series of publication. The dissertation meet all the criteria and standards necessary for the award of the Doctor of Philosophy degree in the specialty AD 10102 Medicine. The candidate deserves a recommendation of the community for quality assurance of the in the field of science and higher education of Ministry of Science and Higher Education of the Republic of Kazakhstan for the confer on the Doctor of Philosophy degree. Thank you.
Thank you, Alena Vladimirovna, for your review. The floor is now given to the doctoral candidate to respond to the reviewers' comments and to present conclusions based on their recommendation. Please, Nұргүл Еркінқызы.
Alena Vladimirovna, thank you very much. I'm grateful for your positive assessment of our work and encouraging remarks that you made. With your permission, I will answer to your questions. First, patients with COVID-19 were selected because the time frame of our retrospective analysis overlapped with the COVID-19 pandemic, and these were the patients who were admitted with pneumonia during that period. According to the results of retrospective analysis of the spectrum of pathogens, we also raised this question, and we believe that multiple factors may have contributed to the findings and the results of our research. First, maybe the widespread empirical use of antibiotics and the subsequent selection of hospital-acquired strains, the reduced circulation maybe of classical community-acquired pathogens, and as well as diagnostic limitations. In addition, as Langford pointed out, the majority of pneumonias during the COVID were viral in a region, and while the development of secondary bacterial infections occurred less frequently, and in such cases, bacterial component was more likely nosocomial, not community-acquired. According to the question about the rapid tests, the rapid tests used in our study were performed within the research protocol, and they are not yet applied in routine clinical practice. However, their use may support earlier etiological clarification and more targeted antibiotic selection, so the implementation could be considered where resources allow. According to the rationale for describing the comorbidities of the patients, the purpose of including this data on comorbidities was not to perform a comparative analysis, but rather to characterize the study populations and to assess potential factors influencing the clinical course and etiological profile of community-acquired pneumonia. According to the regional features, as I said before, Kazakhstan currently faces a shortage of comprehensive studies aimed at investigating the etiology of community-acquired pneumonia. And based on both the retrospective and prospective data, we did not observe clear evidence of uniquely regional etiological profile of community-acquired pneumonia. At the same time, we think that broader studies involving additional regions of Kazakhstan and using diverse etiological diagnostic methods would be needed to determine whether regional differences exist at the national level. According to the diagnostics methods, comparison of PCR and culture methods, we did not do it because we didn't perform it because such kind of analyses were not part of our study objective. And according to the limitations of the study, of course, the results according to each objective has their own limitations, and in all of our articles there is a special subsection and section explaining the limitations of every stage of the research. Thank you.
Dear Alena Vladimirovna, are you satisfied with the applicant's responses? Thank you. The members of the Dissertation Council, we have heard the presentation of the doctoral candidate, the reports of the scientific supervisors, and the statements of the official reviewers. Let us now proceed to the discussion among the members of the Dissertation Council. Who would like to speak and share their opinion on the dissertation? Денис Владимирович.
I thank the applicant for a very nice presentation and a very fruitful discussion. I'm really impressed, as already mentioned, I'm really impressed with the scientific level. And first, when I did have a chance to take a look at the publications, I was quite impressed with the methodology of the systematic review and meta-analysis, which I'm also quite involved in. And I should say that all the different approaches that you use to assess the sources of heterogeneity, along with the sensitivity and stratification analysis in your meta-analysis and systematic review, are also much in line with the internationally validated approaches in the scientific research. So I should conclude that the scientific rigor and the level of those publications is quite high, and they do give a full and quite comprehensive picture of the profile of the agents and antimicrobial resistance in the Ақтөбе population. So this is an example, I'm talking about your publications, this is an example of how well the scientific research should be planned, how well it should be designed, how well it should be implemented. And I've also found, as one of the reviewers noticed and mentioned, I've also found that there is a coherence, that there's a consistency between these three and even more publications, and they all go in line. And admitting that, I should mention that if I were someone to make a decision, I would even give you a degree without the official defense. I mean, just these three needed and extra ones that you do have, publications are quite enough just to make a decision to grant you the degree. So I believe that the scientific level of the research itself and the way it is presented in these international publications is very high. I'm completely satisfied with the answers that you provided, and I'm completely satisfied with the discussion that was already held. So thank you so much for this nice talk.
Thank you. Денис Владимирович, могу ли контактно предоставить вам слово?
I fully agree with the official reviewers, and I enjoy the discussion very much. There is no doubt about the relevance of the research work. The pandemic of COVID-19 has contributed to accelerating the development of antimicrobial resistance, and Nұргүл Еркінқызы's work will help curb this progression. A dissertation defense based on a series of publications indicates the researcher's maturity as a scientist. The revealed regional specifics of the microbial spectrum of the pneumonia will facilitate regional antibiotic therapy in this region. For example, in Almaty, the leading pathogens of pneumonia are Streptococcus pneumonia, Klebsiella pneumonia, and Acinetobacter baumannii. The presentations of the study and well-reasoned answers of Nұргүл Еркінқызы to the questions demonstrate deep command of your material. Nұргүл Еркінқызы deserves the sought academic degree of doctoral philosophy. Thank you for your attention.
Thank you. Thank you, Гулькондыковна. Профессор Дворацка, you may your opinion.
Thank you. I try before to express my satisfaction from coming from the all of work done by student doctorand. However, just now I'd like also to say something what was emphasized by the first reviewer, because the part of this study was like exact part of mapping of the local area related to the risk of bacterial resistance and of course the presence of type of microbes. Those unexpected results which were achieved by the student indicate us how important it is. That is why I'd like to emphasize, to stress especial importance of this work, as well as the something like the first trial to produce more and more studies on these topics, because it is a never-ending story, I suppose, unfortunately. So then, once again, I'd like also to say thank you for excellent discussion provided us by the doctorate student, and I suppose it is the this way she will prove us that it is able to be the member of the scientific society. Thank you very much.
Thank you, Professor Dvoratska. There are still those who want to. Jasur Alamjanovic.
Thank you so much. I think today we discussed very actual problem with antibacterial resistance, and we see today's very good presentation from PhD candidate, and with very interesting teams. And I think I want to again say about the actual problem is not the problem in the Republic of Kazakhstan. It is a problem in our country, in the Republic of Uzbekistan. That's why I think we have to support this dissertation. And this is the dissertation and the results of the dissertation we have to say on the practical medicine. Thank you. I want to support this dissertation.
Thank you, Jasur Alamjanovic. The floor is now given to the doctoral candidate Nұргүл Еркінқызы Аблакимова for her concluding remarks.
Dear Aina Ramazholkova, thank you very much for the opportunity to speak. Dear members of the Dissertation Council and colleagues, allow me to express my sincere gratitude to everyone who contributed to preparation, discussion, and defense of my doctoral research. First and foremost, I would like to extend my deepest appreciation to the Chair of the Board, Acting Rector of West Kazakhstan Marata Оспанов Medical University, Talgar Satabayevich Chabilov, the Chair of this Dissertation Council, PhD Associate Professor Aina Ramazholkova, and Permanent Member of the Dissertation Council, Jasur Alamjanovic Rizaev, Doctor of Medical Sciences Professor Jasur Alamjanovic Rizaev, for granting me the opportunity to present and defend my doctoral research. My heartfelt gratitude goes to the official reviewers, Doctor of Medical Sciences Professor Kirill Alexeyevich Zykov and PhD Alena Vladimirovna Lavrinenko for their fair evaluations, insightful feedback, and encouraging remarks that helped me to enhance the quality of the work. I also wish to thank the temporary members of the Dissertation Council, PhD Associate Professor Marzhena Dvoratska, Doctor of Medical Sciences Professor Amangul Kuangdыkovna Dusenova, and Doctor of Medical Sciences Professor Denis Vladimirovich Vinnikov for their kind support and active participation. I am profoundly grateful to my international scientific advisor, Svetlana Alexandrovna Rachina, for her invaluable guidance, inspiration, and unwavering support. My sincere appreciation goes to my scientific supervisor, candidate of medical sciences, Professor Газель Магинна Смагулова, and PhD Associate Professor Айгуль Закаревна Мусина for their mentorship, wisdom, and continuous encouragement throughout every stage of this research. I am also thankful to the entire team of pharmacology and clinical pharmacology, Center for Masters, Postdoctoral and Postdoctoral Studies of West Kazakhstan Marata Оспанов Medical University, Scientific and Practical Center of our university for their assistance, understanding, and cooperation during the implementation of the study. And finally, my deepest gratitude goes to my mother, whose loves and faith have always been my side, and to my two little daughters who inspire me every day, and to my dear friends who have been by my side throughout every challenge and victory. Thank you so much.
Thank you, Nұргүл Еркінқызы. Thank you for your concluding remarks. Let us proceed to the election of the contained commission consisting of 3 members from the Dissertation Council, excluding the chairperson of the council, and appoint Denis Vladimirovich Vinnikov as the chair of the counting commission. The floor is given to the deputy chairperson of the council and the chair of the counting commission, Denis Vladimirovich Vinnikov, to nominate the members of the counting commission. Thank you.
Dear members of the council, I'd like to present the members of the counting commission who are including Professor Jasur Alimjanovich Rizaev, Doctor of Medical Sciences, and as well as Professor Amangul Kondipina Dusenova, Doctor of Medical Sciences.
Who is in favor on this composition of the counting commission? Please vote in favor. Unanimously, against none, abstained none. The composition of the counting commission is approved unanimously.
According to the order number 126 dated August 20th, 2025, chapter 2, clauses 33 and 34, and the procedure for the defense of dissertations for the degree of Doctor of Philosophy, members of the Dissertation Council who are scientific supervisors, direct academic advisors, or close relatives of the doctoral candidate shall not participate in the voting. Official reviewers are entitled to take part in the secret ballot, and their votes are equal to those of the council members. You will be provided with a ballot paper where you must select one of the following 3 options. Option 1, to recommend to the committee the award of the degree of Doctor of Philosophy to the doctoral candidate. Number 2, to send the dissertation for redefense. And number 3, to reject the recommendation to award the degree of Doctor of Philosophy to the doctoral candidate. I announce a recess for the secret ballot on the issue of recommending the award of the Doctor of Philosophy PhD degree to Nұргүл Еркінқызы Аблакимова on the topic Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and evaluation of the effectiveness of measures to contain antibiotic resistance under the educational program AD 10102 Medicine. A link for online voting will also be provided to the members of the council.
Please turn off the audio and the video transmission without interrupting the broadcast for the duration of the secret ballot.
Не обратите внимания, ящик пустой. Здравствуйте, Жасур Алимжанович.
Здравствуйте. Сейчас, минутку.
Ага,
Я сейчас камеру включу, сейчас. Одну минуту.
Хорошо. Председатель счетной комиссии Денис Владимирович сейчас откроет наш ящик. Сейчас, секунду. Ага. И скажет вам результат голосования. Пожалуйста.
Открываем.
Первый ответ.
За.
За.
Второй
За.
Третий за.
Третий за.
Четвертый за.
Четвертый за. И онлайн голосование. Вот здесь у нас посмотрим ответы. Все три ответа за 100%.
Отлично, спасибо.
Ага, вот член счетной комиссии.
Да, я вижу всех и приветствую всех.
Всего хорошего. До свидания.
Спасибо.
The results of the separate ballot. The floor is given to the chair of the Accounting Commission, Денис Владимирович Винников.
Esteemed Chairperson of the Dissertation Council, esteemed members of the Council. The Accounting Commission, consisting of the Chair, Denis Vladimirovich Vinnikov, and members Professor Jasur Alimjanovich Rizaev and Professor Amandulko Andekavna, reports the results of the secret ballot of the approval of the minutes of the Accounting Commission. 7 members participated in the secret ballot, including 3 members online and 4 in person. According to the results of the vote count, no corrections, erasures, or spoiled ballots were found. Results. Voted in favor of recommending to the committee to award of the degree of Doctor of Philosophy or Doctor in the profile field, 7 votes.
We have heard the report of the Accounting Commission. There is a proposal that approves the report of the Accounting Commission by open vote. Who is in favor of this proposal? Please vote against none, abstain none. The minutes of the Accounting Commission are approved unanimously. Thus, the Dissertation Council has voted unanimously and will recommend it to the Committee for Quality Assurance in the Speed of Science and Higher Education of the Ministry of Science and Higher Education of the Republic of Kazakhstan to award Nұргүл Еркінқызы Аблакимова the degree of Doctor of Philosophy, PhD, on the topic Features of the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and evaluation of the effectiveness of measures to contain antibiotic resistance under the educational program AD-101-02 Medicine. To vote is unanimous. The conclusion of the Dissertation Council is depicted in the following wording. The Dissertation Council for the Educational Program 60-110-100, 80-101-02 Medicine at West Kazakhstan Marata Оспанов Medical University, based on the public defense on the dissertation work in the form of a series of articles by Nұргүл Еркінқызы Аблакимова entitled Features on the Microbial Flora and its Resistance in Patients with Bacterial Pneumonia in Ақтөбе, the introduction and the evaluation of the effectiveness of measures to contain antibiotic resistance under the educational program AD-101-02 Medicine, and according to the results of the secret ballot, recommends to the Committee for Quality Assurance in the sphere of Science and Higher Education of Ministry of Science and Higher Education of the Republic of Kazakhstan the award of the Doctor of Philosophy PhD degree to Nұргүл Еркінқызы Аблакимова. Congratulations, Nұргүл Еркінқызы. Dear members of the Dissertation Council, are there any comments regarding the conduct of the public defense? Нет комментариев. Thank you. I thank all members of the Dissertation Council, our guests, and all attendees for their participation in today's session. this meeting of the Council is hereby declared closed. Thank you.